Section 6. Health and Safety. In this section, you will learn how to support people to maintain their safety and health, get good nutrition, and understand the importance of personal hygiene and regular medical and dental care. You will also learn about how to watch for 8 health conditions that need special attention. Health and Safety. As a DSP, you have important responsibilities for health and safety in home and community activities. Your agency will provide you with the processes that are used in day-to-day health and safety issues and what to do in case of an emergency. Additionally, many health and safety issues will depend on the type of program in which you work. For instance, DSP who support people in employment and alternate day options and residential options play a vital role in carefully observing people and in reporting any changes in their behavior, appearance, or habits that may relate to health and safety. Residential staff members often have the additional responsibility of arranging for and accompanying people to doctor or dental appointments. All programs have written guidelines to follow for health and safety and emergency situations and have procedures for reporting critical incidents. As a DSP, become familiar with all agency protocols. In addition to the information in this section, you will likely receive first aid and CPR training, as well as health and safety training related to your specific agency, to assist you in helping people stay healthy and safe. You may also receive training and be tested in procedures for safe administration of medication. This chapter is not intended to replace that training. Your role is to help the people you support be safe in all situations, access quality healthcare when they need it, assist them in learning and using skills that maintain health and safety, and help them to be aware and informed regarding their own health and safety concerns. Maintaining good health through good nutrition. People with disabilities have the same needs for good nutrition and proper weight management as people without disabilities. Since developmental disabilities are often associated with other medical conditions, such as epilepsy, allergies, diabetes, and heart problems, you may support people who are required to follow a special diet for health reasons or food allergies. Fortunately, today there are a variety of food products available for people who have specific food allergies. Many restaurants offer a range of meals and are accustomed to responding to the needs, likes and dislikes of individual diners. Depending on the needs and interests of the people you support, your role may vary. You may help people plan nutritious and well-balanced meals, oversee meal preparation, monitor and encourage appropriate amounts of foods, and/or assist in making healthy food choices when dining out. Your guidance and assistance will be especially important with aging adults, whose nutritional needs, appetite, and vulnerability to illness are often changing. Just as most of us hope to stay in our home as we grow older, so do the people we support. The supports you provide will play a critical role in helping to make that possible. Important point. As a DSP, it is important to resist the temptation to reward or coax the person you support with food. Food should never be earned, and the people you support may experience the same problems with excess weight as anyone else. When you wish to recognize someone for positive behaviors, offer a meaningful, non-edible reward, which leads to positive experiences such as a short walk around the neighborhood, a telephone call to a relative or friend, positive verbal praise, an opportunity to talk one-on-one, or a short shopping trip. Safety, what's your role? Know safety policies and procedures for people you support and your agency. Learn each person's needs regarding safety. Know needs related to specific conditions such as mobility, vision, and hearing of the people you support. Good nutrition, what's your role? 1. Know the medical and social history for all people you support. Who is on a special diet and why? Who has food or other allergies and what are they? How do you respond to a reaction? Make sure you know where this information is located. 2. Educate yourself on proper portion control. Did you know that one serving of meat is about the size of a deck of cards? Using smaller bowls and plates help us to naturally limit the size of our portions. 3. Monitor what and how much someone eats, but do so in a respectful, helpful manner. Encourage proper portion sizes by helping the person measure his/her food in a container that is the correct portion size before placing it on his/her plate. 4. Prepare foods in as healthful a manner as possible. Bake or grill whenever possible. Avoid frying foods. Use dairy items with lower fat content. Use nutrition charts when helping plan meals. 5. Help people find fun ways to get up and moving. Being active benefits our well-being, and just walking 30 minutes several times a week can help us both physically and psychologically. Personal hygiene. Personal hygiene plays a major role in how others view a person. It is important for all of us to wear clean clothing, keep our hair clean and healthy, and bathe regularly. Because people with disabilities are often seen by others as different, it is even more important to have good personal hygiene. Dirty clothing and sloppy appearances get in the way of meeting new people and making friends. When dressed in clean, well-fitting and stylish clothing, we are more likely to be seen in a positive manner. It is possible that you will support some people who need reminders or guidance to maintain their personal appearance. Depending on needs, your assistance could range from physically bathing to helping someone shop for attractive shirts that are appropriate for his new job. Some may need reminders to bathe themselves, shampoo their hair, shave, brush their teeth, or use the toilet. Others may need you to do many hygiene tasks for them, such as changing a disposable brief or putting on deodorant. Important point. You should expect the personal hygiene of people you support to be kept at a level equal to your own, your child, or your spouse. It is no less important. Good hygiene, especially dental care, is also important for health reasons. Lack of attention to bathing or to routine care of teeth and gums can lead to serious medical conditions. Some of the people you support may not understand this or may not like doing these activities. It will be your role to find creative ways to encourage participation in necessary bathing, shampooing, and other personal hygiene activities if needed. Personal hygiene, what's your role? 1. You provide supports to a young man who drools due to a severe cleft palate. To assist him with maintaining his personal appearance, you might take him to purchase several sets of men's handkerchiefs, teach him how to wipe his chin if needed, or do it for him on a routine basis. 2. You help a person find a dentist who accepts reduced rates for low-income patients. 3. One of the people in your day support program has a new concern with wetting themselves. You alert the program manager, residential staff, or support coordinator so the team can identify the cause, such as medical problems, behavioral communication, or depression, and find a solution. In the meantime, you find short-term fixes, such as keeping an extra change of clothing at the day program. 4. A man you support comes to breakfast wearing sweatpants and a long-sleeved shirt on a hot August morning. He works outside at Walmart. You help him select and change into clothing that is more appropriate for the weather. Regular medical and dental care. Regular medical and dental care is crucial in helping people enjoy a healthy life. Typically, appointments are scheduled and residential staff or family members accompany the person. It is important to work closely with each person's primary care physician and other medical and health professionals to make sure regular routine tests and screenings are completed. DSP often play an important role in communicating to the health professional what someone might be experiencing. All DSP should be on the lookout for changes in appearance or behavior that may indicate some symptom of illness. Some people may not be able to fully communicate what they are feeling, physically and emotionally. It is important to be diligent in observing, monitoring, and reporting any of these changes. The following is a list of areas in which changes may indicate signs of illness or a change in health status. Important point. Dental care is equally important as medical care. Helping individuals maintain a healthy mouth by regular brushing, flossing, and routine dental visits can dramatically decrease health-related issues such as infections and discomfort. Be on the lookout for these. A. Changes in daily patterns. 1. Decrease in appetite or difficulty digesting food. 2. Increased sleeping or unable to sleep. 3. Pain associated with illness or injury. 4. Medication changes and reactions. B. Changes in appearances. 1. Weight gain or loss. 2. Condition of skin, pale, sweating, or hair, unusually dry or oily, falling out. 3. Eyes appear watery or are itchy or red. 4. Skin swelling or redness. 5. Hygiene deterioration, such as body odor, untidy clothing, bad breath. C. Changes in bodily functions. 1. Breathing. 2. Balance or dizziness. 3. Pulse and blood pressure. 4. Bowel movements and bladder control. 5. Use of hands, arms, and legs. 6. Senses: seeing, hearing, touch, taste, and smell. D. Changes in behavior. 1. Obvious change in mood, depressed, agitated, or crying. 2. Combative or argumentative. 3. Withdrawn. 4. Anxious, restless. 5. Obvious change for someone. Previously energetic person appears tired, or a typically quiet person talks non-stop. Regular medical and dental care, what's your role? If you notice any of the changes listed above, you should 1. Note it in the support log or progress notes, and be sure to inform your supervisor and follow your agency's procedures so others can be aware and observant. Documenting these changes can indicate patterns and may be important for diagnosing a health condition if one exists. 2. Get a perspective on the person's history. If you are new to supporting someone and note changes or have concerns, speak to your supervisor, a coworker, or another person who knows the person well. 3. When in doubt, and if symptoms persist, a doctor should be called. Click on the next link to continue the training part 2.